My pain came from an acute injury. I was weightlifting and moved the wrong way and knew instantly that I had done something. It went from something I was just uncomfortable with to continuing to try and tough it out for the next 2 months, and then having to get worse and worse and worse, to the point where it turned into these horrible, horrible stabbing electric jolts throughout my back. So all of my activities went from way up here, crashing down to the ground, virtually non-existent. I'm a runner and a cyclist, and it isn't abnormal for me to run 30 miles in a week and then bike 100 miles that same week. That's just my life, and that's what I do. And then to have that all come crashing down, to not being able to do any of it, was just astounding and depressing and horrible. I went all over the place. I started here locally with a back pain management clinic, did the steroid injections, then went to those medial branch blocks. None of those did anything. I even went so far as to go to an Olympic athletic orthopedic clinic to talk with the top back guy who worked on all the Olympic athletes. And he said, my only recommendation is to fuse everything to stop it from moving. He said, and even then you might not get relief from it. I'm 45 years old at this time. I can't live the next 30 years of my life what I used to do and not be able to do that for the next 25 or 30 years. Couldn't do it. So I was like, that's it. I have to have fusion. I have to do something. So that was the day I picked up the phone, called my local doctor here, tell him what I was going to do. And it's at that appointment that he's like, okay, I get why you want to do this, but let me just tell you this one new thing that has come across my awareness. I have a colleague in Stanford who participated in this clinical trial and had an amazing result with his patient. At that point in time, there were only about, he said, 5 or 6 surgeons, I think, in the country that were doing the procedure at that point. And the closest one to me was Dr. Moore. I set up the appointment, met with him. I remember him sitting there in the office saying, I think you are the perfect candidate for this.
You know, with Lori, she had had an injury, and it was about 15 months from the injury that I saw her. She'd been through a variety of other treatments already, epidural steroid injections, medial branch blocks, and even intradiscal platelet-rich plasma. Obviously, she's motivated, she wanted to get better, and just couldn't get back to her lifestyle. When we took a look at her MRI, she really fit the picture for the procedure. First thing popped up, she's got modic changes. She fit the criteria, having that axial chronic low back pain. She, as I mentioned, was very motivated. So she flew in the evening before. We had the procedure done the next day. She stayed overnight and then flew home. We followed up with 3 weeks later, and she was doing fabulously.
The very next morning in the hotel room, I remember getting up to get out of bed, and I sat up. A regular sit-up using my core. And I hadn't done that since I got injured. When I would get out of bed, I would slide my legs off and push myself up with my arms, and that was the only way I could get out of bed. But when I had done that, and then the light bulb went off, what I had just done. And I was like, oh my God, this worked. This totally worked. It's now 24 hours later, and I don't feel anything. I never felt another electric zap again. It was gone. Every activity I had to quit, I have taken back up with gusto, to the next level even. I'm in the best shape of my life. I have no pain. I have no fear anymore of moving. My life is amazing now. In addition to just running and just doing regular races, I've now added sprint training to my regimen. I do mountain biking again. Can tackle all the trails that I had given up for a year or 2 years. Wake surfing is something that I've picked back up again. And then paddleboarding. I've taken up tennis. And the biggest one was golf. That's the biggest thing I've been able to resume, that I didn't think I was ever going to be able to resume again. I thought I was going to have to quit. You know, for me, doing all of this stuff is my version of an antidepressant. You know, to take that away, okay, now I'm depressed and I'm sad and I can't do what I normally do and what makes me happy. You know, so if I'm not happy, you know, it's just this vicious cycle. It's a wonderful feeling to sort of have this rejuvenation.
You know, our options were limited, I think, prior to Intracept. I think some of the challenges in treating back pain, even chronic pain, is that, you know, there are times where we can do well and we can get some improvement. We may not be perfect, but when you start to talk about a procedure like Intracept, we're not just talking about, you know, some pain relief. We're talking about game-changing pain relief. I mean, I got goosebumps because it just makes me so excited to, you know, hear how she's doing and, you know, to see the results for her.
I have not had any of that pain since literally the day of that surgery. This thing has changed my life, and I wouldn't hesitate to recommend it to anyone if you're a potential candidate for it. Do it. Don't hesitate.